Hello, everyone, and welcome back to our How To Corner. In today's episode, we're going to talk about workers' compensation and injury. Before we get started, please like, share, subscribe, comment, let us know what you think of the content, leave any questions in the comments, and we will definitely answer those questions. Now, let's get going. Today's talk, we're going to cover a few things. We're going to talk about what is workers' compensation. We're going to talk about the process from injury to surgery, what happens while recovery, what does surgery look like when you're actually in underneath the umbrella of workers' comp, and then when do you return to work. So, what is workers' comp? Workers' comp is basically the way that injured workers get help through companies. So, every company has a specific amount of actual insurance that is set aside to be able to take care of their workers if they get hurt at work. And they also have things on site to be able to make sure that people who are injured get what they need. What does it cover? It covers your medical expenses, lost wages, rehabilitation, as far as any type of physical therapy or mental rehabilitation or any type of doctor visits that were basically fall underneath the rehab piece, as well as in disability benefits that you may have access to due to a dismemberment of some kind or some actual loss of life, Lord forbid. And like I said, death benefits for dependents. That's the loss of life part. Who is eligible? The injured worker. If you actually incurred injury at work that's deemed to be, serious, that has to be put into a process of reporting everything, as well as you going to doctor visits to be able to get that worked out, then you're eligible to be covered by workers' compensation for your medical expenses and things you incurred during that time. Steps to file a claim. Most jobs have a process you must follow. So when you get injured, most of the time you have to report the injury through a process, either some type of paperwork of some kind or some type of actual medical providers on site that walks you through everything. Now, the next piece is from injury to surgery, the process. Now, first and foremost, before you even get to the particular point of surgery, there are certain things that have to go into place that have to happen. Your doctor visits, all those things. And if you have the need for a surgery due to a serious injury, then that process would definitely be talked about with your providers. Now, the most common types of injured areas that are usually require some level of surgery are either your back, shoulder, hand/arm injuries. Those are the most common work-related injuries. In addition to this, reporting the injury, importance of timely reporting. You have to make sure when you get injured on the job that everything is reported, that day or as quick as possible. As soon as it happens is a must, right? You must report the injury as soon as it happens. Now, the medical evaluation tends to happen on site by your employer. Um, they have a medical department there for the most part, most of the time, and they're going to evaluate the injury in the sense of saying, you know, documenting what happened, the seriousness of the injury, and then you actually have a situation where it's offsite. Now, you also have an opportunity where, if the injury is deemed to be, very serious or of note of any kind, then you will go off-site where you will meet a medical provider off-site in their clinic and they'll do their evaluation. But usually, an evaluation can happen on site to just determine the severity of the injury, and then it goes from there. The MD, case manager, and injured worker are all a part of the decision making process for surgery. Meaning, after you go to your visits and they've determined that what you have going on cannot be rehab non invasively, then they will try to talk with you and discuss with you your options for as invasive procedures and techniques. But there's an actual team that actually discusses this collectively, and then they proceed to setting up the necessary actual option, surgery, if that's the need. And then at the end of that, you have to make sure you listen to your providers. Make sure you ask the questions you need to ask about your injury. And if you are an actual case manager that's unsure, make sure you reach out to the providers also, ask them questions also about the process and what to expect. Now, what happens before and after the surgery, right? I kind of talked about before a little bit in the previous slide. And the after, we're going to discuss in this side also. But before you have that surgery, there's a pre-approval process has to happen. All the surgeries have to be approved. Once you get injured and they deem that surgery is necessary, it has to be approved. That may take some time, so please be patient during that particular process. But make sure you ask the right questions, about what you need to do to expedite the process. There are also follow-up appointments that have to happen after the pre-approval process is done. This is usually when they do a workup of you and make sure you're appropriate for surgery and before all that occurs. And then the role of the workers' comp doctor and the surgeon, they have a role to play, which means that they monitor your progress after surgery, as well as monitoring all the things that need to happen post-op, as far as your follow-up visits, your medication, your physical therapy appointments, and then a timeline is going to be established, meaning that from the time of surgery, they're really going to chart how long it takes for you to be able to recover. And there's an expectation within that based on the severity of the injury or previous surgeries. They're very similar. So don't be, alarmed that they have you on a particular timeline. Just try to do everything you can do in order to get back fully and healthy from the injury so you can return to your life as well as work. Now, what happens during your recovery? The recovery part tends to be how can I say this? Not always the easiest, in the sense of there's a lot of moving parts. But the one thing that is paramount, physical therapy is super important. There are a lot of injured workers who do not take their therapy seriously, and they should. You should find a good therapist too. I know you have an umbrella of actual therapists to choose from. You may want to ask people who have had injuries similar. You can ask your case manager of some of the better therapists, and they will point you in the direction of it. That's super important for you to be able to have a really good therapist. And then, not to mention, doing everything you're supposed to do, going all to your appointments, make sure you take the medications as you need to, use your ice therapy as needed, and doing the homework. Nothing happens just because you lay in the bed, or lie in the bed rather. Nothing happens except that you stay there and you don't have any improvement, or you make it worse because of contractures that can occur due to not moving after surgery. Now, managing pain and mental health during recovery is super important, because mental health is tied to physical health. Your communication with your employer and case manager are also super important. You must have that communication that occurs with the employer and the case manager to make sure that everything is being charted and documented, and that you're doing what you need to do. And then temporary disability benefits during your time off. When you're actually off during this particular time after your procedure, there are some benefits there that can help make sure you maintain, your household in some shape, form, or fashion until you're ready to return to work. And then modifications at work. The modifications at work tend to come from your MD or your physical therapist. It really depends on what stage in your recovery you're in. Most of the time, a physical therapist or your physical therapist can do the functional capacity evaluation to be able to determine, can you return to that work. And then sometimes your actual doctors may give you a light duty designation, but it's not something that's concrete. It's something that's very fluid. And then after that, you get your release to return to work when you're good and ready to go, and after you hit certain milestones in your recovery within that timeline, obviously. Now, let's talk about returning back to work, right? I mentioned functional capacity evaluations, or FCEs, in the previous slide. I said your physical therapist normally does that. The importance of a functional capacity evaluation is basically for when you've had a surgical procedure, possibly, or just been off work so long, you've been injured, and you're trying to return back to the job. This is used to determine ability to perform work-related tasks, specifically of that job, to make sure that you're safe, one, and that you're not being back into an environment that you get injured. So that makes your employer be safe also, and just judging your ability to be able to perform the task. And if they have alternative placements for you at that job, or anything that needs to occur before you get back to that job, or certain milestones need to be hit, they'll be fully aware, because the functional capacity evaluation is about a 4-hour examination of what you can do, and then the charting of your effort as well as what you can't do. Now, there's a level of medical clearance that occurs. Usually, medical clearance comes after the FCE. Once the FCE is basically done, that FCE determines your ability to be able to do things. The doctor uses that as a way to be able to measure if they are okay with you returning to work and if it's safe. And then last but not least, you have what we call work hardening. Within work hardening, you're basically getting your body ready to do the job. So they're able to find therapists who specialize in that also, to be able to create the job related tasks you do at work and progress you to back to return to work and doing those tasks to some type of actual extent. Now, the re-injury prevention part is super important. You don't want to do anything that's going to cause the injury to return or injure your surgical procedure area. You want to make sure that what you're doing when you work hardening or when you return to work, that you're gradually getting ramped back up into doing that particular job at a full load. Now, gradual return and continued therapy are two things that happen during your return to work. A lot of times you have people who return to work and they still go to therapy in order to manage some of the symptoms they were having. because they did not probably have a procedure, or they did have a procedure and they end up having some issues with spasms or weaknesses they didn't notice, or maybe they kind of sort of had a flare up again. So don't be alarmed if they suggest that you stay in therapy while you're at work, and they make an accommodation for you doing that. And then last but not least, the finalization of your workers' comp case. That's a whole different conversation within itself. The case manager, your employer are involved in that. And as a result of having them involved, you all make a decision what is best for you as well as them. And then that finalization for that case is an actual thing that normally happens between you all as a group. Now, thank you so much for listening. We really appreciate everybody who made it to this point in the talk. We try to make sure we inform all the people involved when it comes to their care, whether that's injured workers, case managers, medical doctors, or just everyday clients who actually have injuries that they're unsure of, in order to make sure that they have some information. We may not provide you with all the answers, but hopefully we provide you with enough answers. And if you have any questions, you can follow us on all our platforms. You can also go to our website and go to our contact page and send us some information or a question, and we'll try our best to answer those questions. And with that being said, we hope you have a blessed one. We'll catch you in the next one.